Right, let's get more on our top story now. Limpopo Health MEC Dr. Poppy Ramathuba has come under fire after a video of her berating a foreign national has gone viral on social media. Ramathuba says her comments are not xenophobic and she stands by what she says, which essentially is that foreign nationals, many of them undocumented, she says, are putting a strain on her department in the province. Well, I'm joined now by Deputy Health Minister Dr. Sibongiseni Dlomo. Doctor, thank you very much for joining us. Do you support the MEC's position?
Sally, good evening and good evening to your listeners and viewers. Let's start by unpacking this. Firstly, there's been a call that we are delaying to come to the media to make statements on this matter. Our Minister of Health is out of the country, so I was actually consulting with the acting minister, Minister Angie Motshekga, so that we could conclude releasing a statement, which we have done. We are doing that despite that we don't have a full context of the video clip and the discussion that was taking place between Dr. Ramathuba and the patient. However, we must note that the health system in our country is overburdened in some areas in providing optimal services for our citizens, including asylum seekers and refugees. Over and above that, Sally, we have also undocumented migrants that we need to support from neighboring countries. Now, even in our NHI document, we do mention that we will provide primary health care for free to all citizens of our country, including asylum seekers and refugees. We're still unsure whether we should also do that to undocumented migrants. Limpopo is heavily affected by this process. We were thinking that maybe the debate should have been at another level, which is already going on anyway, on our bilaterals and multilaterals in SADC, and maybe not find it appropriate to be between a healthcare worker and a patient. So we are gathering all facts, like I'm saying, we did not have all the information, gathering all facts so that when the minister comes back in 3 days' time, Minister Motshekga could be able to brief the minister with all what we are gathering regarding this matter. It's not as simple, do we agree or don't we agree, because there is a background to this, but however, maybe it was an inappropriate space for that discussion to take place at their level.
All right, then let me ask you this. From what you've seen of the video, do you think the MEC was being xenophobic?
No, absolutely not. I'm saying from that clip...
Sorry, so did you think she was being xenophobic?
No.
You don't think that she was picking on an individual foreigner for being a foreigner and making that person feel intimidated, bullied because she's a foreigner? That is xenophobia.
Yeah, I suppose the MEC is putting pressure to those of us who are leading those multilaterals and bilateral discussions to conclude, because yes, it is true that we probably should be at a level that says, if patients do realize, and I'm glad, Sally, you are picking up that even though quite a lot of people in the media criticize the department and our government for poor health services, there are people out there in the world who think that we're still doing it better than anywhere. So when patients walk across the borders of our country to come in here and receive services, the discussion should be concluded. What should happen to those countries? Shouldn't they pay a particular quota amount of money? Because patients do come across not only just for primary care, for more than that. Now, that discussion should be concluded. All I'm saying that holding that discussion with the patient probably was not an appropriate space. It should be at our level, finding policies that would guide and actually get bilaterals and multilaterals in SADC to guide us how to deal with.
I hear you, and we'll get back to that. But I just want to get to this because we're looking at a situation where an MEC, who is a very powerful person, is in a hospital visiting patients. And she's not only an MEC, she's also a doctor. And doctors have a duty of care. And sometimes doctors have to treat terrible criminals, but they're sick. And you have to put aside what you think personally and treat that person. Are you not prepared to condemn what she said, either from a doctor's point of view or as a representative of your government?
Sally, I'm repeating this to you that one, we would have to get and gather all the information around that video clip and present that to our principal, the minister, who will then be guided by that full context of what actually happened there. We just cannot probably take that in silence. All I'm saying that, but probably I could still say to you, that is a discussion at a policy higher level than.
So why did she direct it at a patient? I mean, that's the point I'm making, is as a politician, it was surely misguided to pick on a vulnerable patient. And as a doctor, it was unethical. And even I can see that.
Sally, we'll need to get all the information to that. All I'm saying to you that it is true that one could conclude that it was probably at an inappropriate level for that discussion to be between a health worker and the patient.
Inappropriate, all right. And you'll come back to us. I've got that. I want to raise this issue of foreigners in South Africa. I spoke to Dr. Dale McKinley, and he says that foreigners are being used as a scapegoat, and there are all these figures bandied around from 12 to 15 million foreigners in South Africa, most of them undocumented. He says the research they have is 4 million in total, if that, majority of whom probably have documents. When you say that the Limpopo health system is being overburdened, it's one of the provinces that's really battling with a lot of foreigners, many undocumented. Give me the numbers, give me the stats of how much pressure they're putting on the health department in that province, because let's deal with the facts.
Sally, you there in the studio and me in the office, head office, will not have those numbers. But if I can go hospital by hospital, starting at Chris Hani Paragonat Hospital, Charlotte Maxeke, do all those in the whole of the Gauteng and move on to Limpopo, you'll get those figures. I don't have them here now. I can't give it to you.
My point is the MEC doesn't know them either. If you don't know them, I'd argue that she doesn't know them. And isn't that a problem, that she's working on a perception which is highly problematic, because we're dealing with South Africans who are emotional about the state of healthcare in this country, which frankly is problematic. And then a perception on top of that, and we don't have the facts to know just the impact of foreign nationals, undocumented foreign nationals.
Sally, that you do not have the accurate figures does not mean that is a perception. Absolutely not. We can give you for a fact, real. Doctors who treat those patients in across Limpopo and Gauteng can give you the stats. I didn't come here with the stats ready for you, but I'm saying that is not a perception. It is actually true that there are patients all over the SADC who will seek a better healthcare elsewhere than where they are. We need to discuss and finalize that at the policy level, how that is harmonized across all countries in SADC.
Yes, in fact, let's just pick up on that last point. The point that Dale McKinley was making is that we are obliged in terms of our constitution to provide healthcare to anyone who needs it within our borders, which is quite a progressive policy. But at the same time, the MEC and you are talking about the fact that there are talks with the officials in Zimbabwe, possibly up to the presidential level, about some sort of system, whereas if we're treating a lot of people who are coming to South Africa to get help, there needs to be some sort of payback. Talk to me about that, and whether we are looking at a system in South Africa, perhaps a change in laws that would say South Africans have to be treated first. Because unfortunately what's happening is a lot of South Africans are saying this is not fair. They're blaming foreign nationals for a lot of the problems in our system, which we know is not actually fair, because there's corruption, as I would say, is the number one culprit. But there's also a sense of justification saying, well, I'm going to push the foreigner to the back of the queue. So talk to me about the regional discussions and policy discussions internally.
We cannot question the international law that expects all of us, all over in the world. No country will not be giving a foreigner the primary health care. And there's a package of what is primary health care. But some of the things that we see in our country, you will totally not get in Canada. You go to US, they will tell you this is at the level of giving you. Beyond this, thank you very much. We will not give you. We have not worked that policy to that level. But it's not unfounded in the world to provide any foreign national with a package of primary health care free of charge, like the citizens of that country. Beyond that, there is a payment that must be due. That part we have not finalized and harmonized in SADC and in the neighboring countries.
All right, thank you very much. Deputy Health Minister Dr. Sibongiseni Dlomo certainly not condemning what the Health MEC in Limpopo said, in fact acknowledging that she was raising a lot of issues that are currently under discussion, highlighting though that South Africa is obliged in terms of human rights, our constitution and international law to provide health care to a certain level for foreigners, no matter what their status in this country, but also acknowledging that it seemed somewhat inappropriate that the MEC had that discussion with a patient ill in a hospital bed.